Hello everyone, please get seated, and we're very excited to get this master's Cathryn Tonne we started, and couple of keeping goals first. First of all, for the students, you need to sign the ministry, and also remember to submit your questions to the speakers ahead of the Sunday. We do have options of outside the year time. So then we have almost 100 people there. So this is another record we can we did the last time. I think just Michelle Bell. That has a very good start, and which gives me the great honor to introduce our speaker. Dr. Tonne is a professor at the Barcelona Institute for Global Health. Or called It's Global, is an environmental epidemiologist focusing on the health effects of air pollution from traffic and how to. Her research has investigated exposure patterns in low but also middle and high income countries and has co-benefits for climate change mitigation via air pollution. So she is the co-director of the Lancet Countdown Health and Climate Change in Europe and leads the working group on mitigation. And she's also the member of the WHO's technical advisory group on air pollution and health, focusing on the climate change, air pollution and health. She also did many projects. One of them is the European Research Council's cardiovascular health effects of air pollution in India, and then also calling 5-year European Horizon project called CATALYSE, focusing on climate change and health. She has many awards as well, but I want to mention today one of them specifically is the 2022 Tonne Michael Award by the International Society for Environmental Epidemiology. For those of you who might not know, Tonne Michael is the pioneer epidemiologist who links climate change and public health. So, without further ado, it's our great honor to welcome Dr. Tonne.
Well, thank you so much, Kai and the Center, for the invitation to be here. It's really a pleasure. And okay, that's good. So what I'd like to do today, just very briefly, is give you a little bit of, related to climate change mitigation goals, and then to some of the details of how we conceptualize and quantify the health co-benefits of climate change mitigation. I'll also mention a little bit about the Lancet Countdown for climate change, which, as Kai mentioned, I'm involved in, and then hopefully we'll have time for a very short exercise to get to thinking and stimulating discussion related to the health co-benefits of mitigation. So, needless to say, climate change is an incredibly complex. A safe, stable climate is a vital public good that requires global governance. Obviously, emissions emitted in one location have impacts on populations in the other side of the globe. It's very complex and poses really thorny problems in terms of global governance, in terms of not just what to do, but who are sort of the actors that are involved in global governance related to climate change. And, who really gets to participate in the process. So in terms of responding to climate change, the main governance mechanism that we have is the UNFCCC, so the Framework Convention on Climate Change. This went into force in 1994 and has near universal membership by parties. So the signatory parties are nation states. Which sort of gets at this question of who gets to participate in this process. It's really nation states. And the aim is to prevent dangerous human interference with the climate system. So the UNFCCC puts the onus on high emitting developed countries to lead the way in terms of mitigation and to finance. It directs finance flows to activities in developing countries and has a series of reporting requirements on greenhouse gas emissions and plans for adaptation and capacity building. So part of the UNFCCC is the Paris Agreement, which I'm sure you've all heard of. And this gives us the specific targets for warming by the end of the century of 2 degrees and 1.5 degrees. Essentially, it operates on a 5-year cycle of increasing ambition for action. And countries essentially submit their nationally determined contributions that lay out their plans for emissions reductions, but also their plans for adaptation and commitments for financing. And as there is a global stocktake process built into this, which has just so something has
Click on the mouse, sorry.
With the mouse?
Yeah, click mouse on the yes. Yeah, now it works.
Okay,
Yeah.
So so we have a plan, the UNFCCC, we have this global governance response, we have the Paris Agreement. So where are we in terms of meeting the targets that were set out in the Paris Agreement? Well, that is sort of summarized here in this figure from the UN EP emissions gap report. This is from the 2022 report. And essentially here are the emissions pathways that are consistent with the 2 degree and the 1.5 degree targets under the Paris Agreement. So the 2 degree target is in blue there, and the green shading is the 1.5 degrees. So this essentially shows you the range of emission pathways that are consistent with limiting global temperatures below 2.5 degrees with a 66% probability. So it's not 100%, it's 2/3. And you can see these emission, where we want to be in 2030. So where we are now is shown here. This is basically here. This is where our current policies would take us in 2030. This is where we would be if the nationally determined contributions that have been submitted under the Paris Agreement were fully implemented. So you have the unconditional NDCs and then some additional emissions reductions, which are part of these conditional NDCs, which say further emissions if another country does. So essentially what this shows you is that there remains a really substantial gap between what has been pledged in the Paris Agreement NDCs and where we need to be to reach the 2 degree warming target. But of course, to adequately protect public health of the populations on the planet, we really need to be looking at the 1.5 degree target, where we have really a long way to go before we are on track to this target. So I mentioned that built into the Paris Agreement is take process, which really is to monitor the sort of collective progress under the Paris Agreement. So this sort of first round was just published earlier this month. So you can see some of the key findings related to mitigation that I've pulled out here. Essentially, the agreement is working, action is proceeding, but much more needs to happen. It's progressing far too slowly. You have action by the parties, but there's really an important role for these non-party actors, including civil society, the private sector, financial institutions, and subnational authorities, including cities. We need urgent action to ramp up implementation of mitigation, and this really needs to happen across all sectors. We need systems level transformation across all sectors and basically everywhere. And this really invariably has to involve scaling up renewable energy, phasing out fossil fuel use, as well as dealing with deforestation and targeting non-CO2 emissions. So where are we in terms of emissions? We still have not peaked in terms of global greenhouse gas emissions. Emissions continue to increase. There was this sort of short reduction during the COVID pandemic, but we've essentially rebounded from that and emissions have continued to increase. So you can see much of those emissions are related to fossil fuel based CO2, but I think it's important to point out the contribution of these other non-CO2 greenhouse gases like methane here. So you can see it's quite a sizable contribution from methane that has been increasing over time and is quite important when we start thinking about the health co-benefits of climate change mitigation, essentially because it's a short-lived greenhouse pollutant, which I'll say a little bit more about in a minute, and is one of the main sources of methane is related to our food system, which has direct implications for health. So probably this looks somewhat familiar. Obviously, when we start looking at specific sectors that are contributing to global greenhouse gas emissions, much of it is coming from energy. This is energy in industry, in transport, in heating buildings. But almost 20% are coming from agriculture, forestry, and land use. So we want to keep that in mind also when we're thinking about what should we be thinking about in terms of how mitigating climate change can also deliver health benefits. So we have this concept of co-benefits. Maybe you've heard this term before. It's not a very satisfactory term, in my opinion, because I think it's quite non-specific. It essentially gets at this idea that you have positive effects of a policy with a sort of primary target that also has impacts on another target. So in this case, we're talking about mitigating climate change. That's the primary objective, but it has these ancillary other impacts, which could be co-benefits on the environment, on the economy, or on public health, which is what we want to talk about today. So what we're talking about is the health co-benefits of climate change mitigation. There are also co-benefits of adaptation, which for the interest of time, I won't say much about. And they have other names, ancillary benefits, sort of win-wins, which sometimes makes it quite hard to, sort of identify where this concept is being used in sort of the broader discussion around climate change. So this is a conceptual model from a review looking at the co-benefits of climate policy, and you can see there are many different pathways here. And most of them eventually end up in one of these, leading to these sort of purple boxes, which are related to human health and well-being. So at least on a conceptual level, we believe that there are these various pathways linking climate change mitigation to health and well-being. But when we really look at the literature in terms of what has been actually quantified, the literature is very dominated on the co-benefits related to air quality. So what does climate change mitigation mean for air quality? This is where really the bulk of the literature has focused. Some of that literature goes the next step in looking at what that means for public health, but we have much less evidence related to some of these other really important pathways related to diets, to physical activity, to biodiversity. So it's, it's not a small literature, but it's a very unbalanced literature. So now let's go a little bit further in looking at the co-benefits of the health co-benefits of mitigation. Why is this concept compelling? Why is it important to do this research trying to quantify these health co-benefits? Essentially, as I see it, it's a way to engage actors who might not otherwise be engaged in or motivated to mitigate, because it essentially highlights this direct benefit to them and sort of enhances the incentive for them to take these steps in terms of mitigation. And that is because the health benefits and the associated economic benefits basically happen locally, while of course the mitigation benefit is diffuse and happens at a global scale. The health and economic benefits happen in the area doing the mitigation, and relatively immediately. So phasing out a coal-fired power plant, the improvements in air quality are relatively immediate. The impacts on public health are relatively immediate. And so it really adds this other sort of lever and I think set of incentives for action. So essentially, we're trying to identify whether there are these sort of win-win interventions that can deliver greenhouse gas emission reductions as well as improving public health. And this is, I think, a nice example focused on air pollution. So on the list, you have here over on the side a set of interventions in different sectors that are ways we know we can reduce air pollution. So you have these interventions sort of mapped out in this kind of solution space here with the health benefits of reduced PM 2.5 refined particles on the y-axis, and on the x-axis, the reduction in CO2 equivalents. The size of the bubble is related to the cost effectiveness, and the color is related to the difficulty of the implementation. So you have these very clear sort of win-win interventions like this one here, which is essentially phasing out coal-fired power plants and replacing them with renewable energy. It delivers both the health benefits, the reductions, relatively easy to implement, very cost-effective. In comparison to something like this, which is doing a great job of reducing attributable burden to air pollution, but doesn't really have the impact on greenhouse gas emissions. And so what that corresponds to is removing sulfur in diesel fuel. So I mentioned short-lived climate pollutants. These are powerful climate forcers that remain in the atmosphere for a much shorter period of time than CO2, but have much higher warming potential. So they're really important targets for mitigation in the sort of nearer term. And several of them are very relevant for health. So I mentioned methane. There's also black carbon, which is a subset of particulate matter, which is health damaging, and ozone, a secondary air pollutant as well that has direct health effects. And it's estimated that with cost-effective technology we have now, we could reduce black carbon by 70% by 2030 and methane by 45%. So there's really a big potential benefit of focusing on these non-CO2 greenhouse pollutants in terms of their near-term benefit. We also have to deal with CO2, but this is important. So when we look at the work that's been done to quantify the health co-benefits of climate change mitigation, the vast majority of the evidence that we have are based on modeling studies. There is much smaller literature that are based on observational studies, which are very important because then you can really start to see how some of the barriers to implementation of policies and some of these unexpected consequences or unexpected consequences that play out in reality affect how far we can go in terms of achieving these health co-benefits, but mostly it's done through modeling and scenario modeling. So asking these sort of what if questions. And so some of the considerations in doing that kind of study is, really, are the scenarios meaningful? Is it clear what the reference is? Is it clear what the baseline is? How far to project into the future? In terms of the climate change community, they often project out to the end of the century where you can really start to see big differences in different scenarios in terms of warming. That's much trickier to do when we're looking at health because there are so many uncertainties around demographics, the health status of the population. So it's much more typical to see something like 2050, 2040. If you're taking this population into the future, what aspects of the future can be projected and changed is really an important part of these kinds of studies in terms of economic development, urbanization, demographics, all of these things which are really important drivers of public health, potentially need to understand how they're impacting the estimates related to the co-benefits. And I think it's very important to keep in mind that the goal of these studies is not to predict, what's going to happen in the future. It's really to gain insights into sort of what are the big drivers of future health under these different scenarios. Is it economic development, or is it the specific exposure pathways that we can influence with these mitigation actions? So this is a sort of conceptual diagram linking, showing the pathways linking mitigation actions and health. What you see here are the sort of main sectors of the economy that have the most important impact on greenhouse gas emissions. So when we're thinking about where to do the mitigation, you want to do it where it matters, focus on the sectors that are contributing most. Then these interventions in these sectors have the potential to influence a number of exposure pathways. Obviously air pollution is there. It's linked to basically all of these different sectors, but it's not just air pollution that we should be thinking about. There are a number of other relevant exposure pathways that can be impacted, and we know much less about really what those the co-benefits that potentially can be achieved through these exposure pathways. And these are linked to a number of different health outcomes. So, non-communicable diseases, mental health, infectious diseases, unintentional injury, potentially when we're looking at interventions that impact the transport sector. So this sort of summarizes into some of the things that I've said before, but in starting with this kind of modeling work, essentially the first steps are to identify the scenarios, develop the scenarios, to set a very clear baseline to determine the population and what timescale you want to look at, identify which drivers of health you want to include in the projections, so demographics, health status. There can be time trends in the exposures that exist aside from the impact of the mitigation action on the exposure. Then you move to this impact assessment step here, which is estimating how the mitigation action influences those exposures that I was mentioning. And then how the change in exposure impacts health outcomes. And this is usually done by either using this second step here by using exposure response functions from epidemiology studies that have been published. So you want very robust estimates. So these typically come from well-established relationships where we have a lot of literature that can be summarized in systematic reviews and meta-analyses. That's one way to do it, is to use these sort of exposure response functions from the literature that are external to the population that you're actually doing modeling in. But there are also opportunities to potentially fit your own exposure response function in the population that sort of changes the assumptions that you're making. You don't have to sort of extrapolate it, an FE estimate from another population to your population. You can generate it in your population if you have, let's say, big enough sample size to get a robust estimate, and then take that through into the health impact estimation there. It can be potentially very impactful to add economic valuation onto those estimates to try and quantify the economic value of the health savings and compare that to the costs of mitigation. Because what you often see when looking at climate change mitigation is a huge emphasis on the costs of mitigation action. And what you often don't see is enough, let's say, discussion or let's say reference to what we know about the potential benefits of mitigating. And that discussion really needs to be balanced out, because there are huge savings that can be achieved through some mitigation strategies. And then in this last step, it's about testing some of the uncertainties through sensitivity and uncertainty analysis. So I wanted to give you a few examples from the literature of studies that have done this. So this is a paper that was published a few years ago from Anil Markandia's group. He's an environmental economist, and this is looking at different pathways to achieve the Paris Agreement targets of the 2-degree target and the 1.5-degree target. So you can see what these different scenarios look like in terms of CO2 emissions out to 2050 here. So, well, I guess you can't see that it's being covered up there. Anyhow, those scenarios, you have, okay, thank you. This is the baseline. This is what would the emissions look like under the nationally determined contribution. And then this is what the emissions would look like under these different targets, the 2 degrees and the 1.5. But then what they did is look at who does the emissions reductions. So they have these different scenarios, CAP, CER, and UPC. So in the CAP scenario, countries with the highest historical emissions make the biggest cuts. CER, the countries that have the highest per capita emissions in baseline continue to have high per capita emissions. And then in EPC, you have a sort of convergence in per capita emissions. And then what they did was look at the deaths that could be avoided due to air pollution under these scenarios. And you can see that you have the lowest attributable burden to air pollution under this CAP scenario. So basically, in a way, the most equitable way to get the emissions reductions. And what I didn't include here is the work that they did on the costs associated with this. But what is clear, particularly in world regions that have high air pollution levels, that the costs savings from the reduction in mortality from air pollution outweigh the mitigation costs. Oh no. Here's another example, which is looking at food systems. So this is a paper from Marco Springman from a few years ago, and this is looking at the health and environmental impacts of dietary change in 2050. And you can see here the scenarios. So there's a reference scenario, which is essentially just projecting future diets. This is done by the Food and Agricultural Organization. Then there's another scenario, which is based on healthy eating guidelines, in terms of diet composition and also energy intake. And then a scenario with high levels of vegetarianism and high levels of veganism. And on the left-hand side, you see the avoided deaths relative to the reference, broken down by the risk factors. So you can see this color here is related to the caloric intake. So basically, reducing being overweight. Then this is related to lowering red meat consumption. Increasing fruit and vegetable intake is here in green. So what you see there is that the more plant-based diets deliver very large health benefits in terms of avoided mortality, and this is really driven mostly by reducing red meat. But that when you look at that's globally, and then when you look at different world regions, you start to see some sort of interesting patterns. So, for example, in South Asia, where there's not very high levels of red meat consumption, the benefits are really coming from increased fruit and vegetable intake. And then here you can see a little more on where those emissions are coming from. So the change in food-related greenhouse gas emissions under the scenarios, really with the plant-based diets, you see, huge reductions in emissions really driven by reducing red meat. Yes. This is just another example, which is looking at active travel. So this paper, they looked at different sectors. I've just pulled out the results related to active travel, where they're looking at meeting the Paris Agreement targets in a number of countries by essentially getting people out of private motorized vehicles and into active transport, so walking and cycling. And you can see that under these scenarios where you have very high levels of walking and cycling, so the sustainable pathway and the health and all climate policies pathways, you get quite large health co-benefits, particularly in places that have low levels of active travel at baseline. Kai mentioned that the CATALYSE project, this is a 5-year Horizon Europe project that I lead. We started last September. So, but one of the big focuses of this project is related to quantifying the health co-benefits of climate change mitigation in Europe, really responding to the policy context in Europe to provide evidence to guide policymaking in Europe, as we're there are a lot of discussions on how to get to net zero, which is a legally binding target for the European Union. So there's a net zero target for 2050. How do we get there? We want to make sure that we're providing evidence on how to optimize health in that pathway. So there are many parts to the project. Aside from the health co-benefits of mitigation, there's a lot of work around early warning systems and sort of developing surveillance systems. A big focus on knowledge translation. So how does evidence get used by policy and decision makers? How can we do it better, basically, so that evidence gets into the policymaking process? And then there's a big focus on health systems, both in terms of the adaptation, but also mitigation in the health system. And the project overall, really tries to answer these 3 questions. How do we optimize health in climate change mitigation and adaptation in Europe? How to close this knowledge to action gap to accelerate climate change action? We already know a lot, but that evidence doesn't get used often. We want to understand why and how to improve that knowledge translation process, and then how should health systems adapt and reduce their carbon. So just to say a little bit about the work related to co-benefits there, we'll be doing work. A lot of work goes into developing the policy scenarios. What are the main policies? What scale of ambition do we want to cover? How do we translate a specific policy on a piece of paper into emissions of greenhouse gases and air pollutants? We're also looking at some other environmental system impacts. And then how to go from that mitigation action to changes in the exposure pathways that I was talking about before. So we're doing that for buildings, for food systems, transport, and then we'll do a sort of integrated social cost benefit analysis at the so just moving on to say a little bit about the Lancet Countdown. Who's heard about the Lancet Countdown for climate change? So that's great. Basically, there's a family of countdowns. So the main one is the global countdown. Then we have regional centers that are focusing in more detail on specific regions, and but they more or less follow the same structure. And really, the purpose is to track progress or the lack thereof in addressing climate change as it relates to health. And the main output are these indicator reports, which are published more or less annually, which really are these, where are we? Are we improving or not improving? And it a very useful sort of communication tool for a number of different audiences to really make that link with health very clear, because in many instances people are thinking about climate change but not necessarily linked with health. So the European Countdown was established just a few years ago, and the first indicator report was published last autumn, so in 2022, and we'll have another one in the spring of 2024. And it follows more or less the same structure as the global countdown. So we have different working groups, and the first working group is focused on the health impacts of climate change. So really indicators that track climate change related hazards, population exposure to those hazards, population vulnerability, and climate change related sort of impacts. So there's a lot of focus there on temperature, on infectious diseases, so changes in the suitability of different infectious diseases or vector-borne diseases in Europe, pollen, wildfire smoke. These are some of the indicators that are in that section. The next working group focuses on adaptation. And so this is looking at indicators related to planning and preparedness for climate hazards at different scales, the level of implementation of these plans, and then implementation of early warning, monitoring, and response systems. So the third working group is focused on mitigation. So this covers these non-health sectors that I was mentioning earlier, but we also include here mitigation in the healthcare system in this working group, and essentially are trying to track where we are in terms of level of mitigation and some of the attributable burdens for some of these exposure pathways. So here are some examples from the last indicator report. So this is an indicator tracking the carbon intensity of the energy system in Europe. So you can see here, this is 2050, where we need to get to net zero across all sectors, and where we are now. So these are the observed data, basically. If you just extrapolate that out, you're on that black line, which you can see is very far away from where we need to be. So this slope needs to be 5 times greater to get us to net zero by 2050. So huge need to accelerate decarbonization of the energy system in Europe. It is going in the right direction, but just really not fast enough. You can see more or less a similar picture with coal phase out in Europe. So coal has dropped a lot since the 90s. You can see 56% reduction since 1991, but it still comprises about 12% of the energy supply in Europe. That even, it was complicated further with the Russian invasion of Ukraine and what that did for the energy system in Europe. There was back to coal. The current rates of reduction are incompatible with reaching net zero by 2050. When you look at it by country, there are some really interesting things going on here. So you can see some countries that have been very successful at phasing out coal, like the UK here, and also Spain is this here where, they've basically done it. And then you have some other countries, particularly in Eastern Europe, that still have very high levels of coal, and this is a really important sort of driver of some of the political discussions around this. So this is an indicator related to premature mortality due to fossil fuel combustion. So you can see the air pollution attributable of deaths by European region and by fossil fuel type. So you can see in most of Europe, the main driver of air pollution related deaths is from basically transport, liquid fuels for transport. In Central and Eastern Europe, it's a different picture where it's much more about coal from power plants and from domestic heating. And the one point just to mention here is that while you see quite clear reductions in the attributable mortality over time, many of these have been achieved through sort of technology improvements in terms of vehicle efficiencies and things like this, which have reduced the air pollution, but have not delivered the CO2 emissions reductions. So again, there's an opportunity for win-wins that is not being achieved here. And this is an indicator related to food. So you can see between 2010 and 2019, very little progress in reducing emissions associated with food demand. And really animal source foods that are responsible for most of those emissions. So this is, basically meat and dairy. So going back to the working groups, we have a working group focused on economy and finance that's really trying to track the cost of climate change related health impacts and what the economic transition to a low carbon economy would mean. And then finally, a working group focused on politics and governance, and they're really looking at engagement with the concept of climate change and health by different actors, citizens, media, governments, and civil society, the private sector, for example. Okay, so now what I would like to do is a short exercise to get you thinking. I'm seeing some yawns, so it's definitely time to stop talking, and you can now do something a little more interactive. And the idea to start thinking about how to maximize health in this path to net zero, and who is responsible for driving this change. So what I would like to do is split the room into three groups, and maybe what I would do is by row. So maybe these two rows can be group 1, these two rows can be group 2, and the rows in the back can be group 3, and if anyone else isn't included in, sitting on the side, fine, this first group, which is quite small. So what I would like you to do, first, I would like to show you this figure, which I think is really a powerful figure, which comes from this report called The Future Is Now, which is looking at transformations for sustainable development. And it refers to these different levers of change. So, we have not just governance, it's not just about setting laws, banning fossil fuels, this kind of thing. There are other levers that are important to think about, economy and finance, so taxation, subsidies, but also individual and collective action, and the role of science and technology or the private sector there. So these are, I think, very powerful levers that I want you to think about in going to the next step. So what I would like you to do is each group to take a row. So group 1, if you could take the first row here, group 2, the second row, and group 3, the third row. So you see there are some cells in the rows that have been filled out, but what I'd like you to do in the next 10 minutes is to discuss amongst yourselves and fill in the other rows. And then will feed back to us what you can. So each row is referring to a mitigation action. And then, you can discuss sort of what that means in terms of, is this, you can also edit or, modify the information in the rows if you think, in the cells, if you think that's relevant, but, this is, basically identifying the lever of change, who does the change, what does it mean for air pollution, basically because, pollution is one of the big exposure pathways, but there are other potential exposure pathways that you should be considering. And then what are the equity issues associated with that? Because obviously considering the equity issues is really essential to make these mitigation socially acceptable, basically, if we want to really see them implemented in policy. That has to have consideration of equity issues, is part of this idea of a just transition. So what needs to be included there. So over to you. I'll give you 10 minutes to fill in the blanks.
Actually, we will. Because we have a meeting
really?
after this, so we
Okay. Okay. Okay, so maybe you have, I don't know, 2 minutes and you can tell us what you come up with.
Yes.
Okay.
Anyone?
Sorry, in the midst of my step. Yeah, it's still.
Right? Yeah, and the detector.
Like they used to. It seems like it's but I see regularly, but.
That's true.
Government benefits.
No, but.
Like the street.
Yeah.
Like.
Yes.
Around the individual cars.
Something is like.
I think maybe we should reduce.
I feel divested.
So that's noise and
One of themselves, I think, I don't It would be the same thing, it's money, right? They're like, things, much money, and I'll know here it will grow by X amount.
like me, I don't have a car.
You know, you could do really well over the long term, or a lot of energy company. Yeah, so for like other investments as well. The urgent students, they like, we all have money, that is the product of. But it's like. $1 million, for the technically, which is taking a lot of things. It's to these companies inside exposed.
I realize that was quite short, but maybe we start with the first row, if you can tell us one of the cells that you.
We were discussing universities actually, and like how they are investing in fossil fuels sometimes, so they could be an agent for change if they stop the investing. That's started as. Yeah.
So of those levers of change, what would you call that? So here we have governance and science and technology, but.
This is like the, you can say university education.
So probably collective action, you know, by institutions. These are you know, essentially private public institutions. And I think that could be there. Okay. Very interesting. The second group. Okay.
or like having policy to like give funding for change?
Okay, so this is, so what cell does that refer to? The lever for change or the agent? Who would be making these changes?
Well, we actually narrowed down to, for the agents of change, private car companies. For example, we have a Tesla who are mass producing cars, electrical cars that do not hurt the atmosphere, that promotes the climate action we're trying to, advertise. So agents of change there would be the government that produce funding or policies that would help them and invest in resources to create more electrical private car companies.
Okay,
That's what we were thinking.
okay. The third group?
We talked about a target sector for mitigation being like CAPOs and really large industrialized meat industry. And then we also had some good conversation about equity issues, talking about like affordability of plant-based diets, food sovereignty talks about replacing the industrialized meat sector with smaller scale or family-owned practices.
These are really, it sounds like you had very interesting discussions and, and I wish we had a little bit more time, but I think we have to close now. Thank you very much. I'm around if people have questions.
I just stuck out here in the group for a second, but I'm a pediatrician from the Midwest, and I've been interested in climate change as it relates to health, although that's not my category of study here. But I feel like as a pediatrician and as a physician, you don't get a lot of information on how we can affect policy and change, both directly to our individual patients, but then also on a broader scale. And I wonder if the health provider sector can also be a targeted sector.
It's a huge agent for change, and there's a lot of really impressive momentum building among health professionals to be this sort of active voice for mitigation in the health sector. And then there's also the issue of adaptation, but even in mitigation, as there's a lot of really interesting stuff that's going on, which I would say is sort of at the level of civil society. So these different organizations of health professionals, but also at health systems level. So different health systems that are really engaging in this issue. So let's stop there. I think we have to get out of the room.
Yeah.
Thank you.
Everyone in the classroom, sounds ready, so take it the long line. And thank you everyone for joining online.
So